Hi, my name is Sandy Lockhart and I'm the Executive Director of the Gravenhurst Chamber of Commerce. I'm here to provide training on the Ontario Chamber Network's COVID-19 Rapid Screening Initiative using self-collection rapid test kits. That means there will be no swabs here, but don't worry, your staff do it yourself. You don't have to do it for them. This initiative is a partnership locally of the Chamber of Commerce of Orillia, Bracebridge, Huntsville, Lake of Bays, Muskoka Lakes, and Gravenhurst. The goal of this program is to identify asymptomatic cases of COVID-19 in the workplace that might otherwise be missed. This will help curb the spread in the workplace, at home, and around the community. I'd like to thank everyone, all the businesses for stepping up to help keep our workplaces safe. I have a few housekeeping rules before we get into the screening process. Our first defense against this virus is vaccination. But until everyone is vaccinated, we must remember hand washing, physical distances, and wearing masks. But these screening tools, they are also an effective tool to help keep our community safer while we wait for the vaccine rollout to be completed. Rapid antigen testing for screening purposes should not replace existing workplace prevention and control measures. Rapid screening must be conducted in accordance with the Ministry of Health COVID-19 guidance, which can be found online. These kits are not to be used by anyone showing symptoms related to COVID-19. Do not use this to screen to verify someone who is showing signs. Individuals showing signs or symptoms must immediately report to Public Health Assessment Center for a full PCR diagnostic test. The provincial and federal governments have made these kits available for small and medium-sized businesses for free. However, there is a mandatory requirement that you must report usage in order to continue receiving kits. Return to rapidtestmuskoka.com or rapidtestorillia.com where you first received your kit to update the results. Finally, if you screen an employee presumptive positive, they must leave the workplace immediately, self-isolate, and book a PCR test at an assessment center within 24 hours. These employees are not permitted to return to workplace until they have a negative PCR result from your local public health unit. These requirements are vital. We cannot keep our workplace safe unless you are following the guidelines and putting extra effort into keeping employees and their families safe. 1/3 of all COVID infections are asymptomatic. That means no symptoms at all. So if we can find the asymptomatic cases in our community and in our businesses, we can help curb the spread of this disease. The process of self-swabbing is extremely easy, but according to government regulations, they must be under the direction of a supervisor who is an individual who is known to be trained. Training is available through training videos. And remember, self-swabbing is voluntary. You cannot mandate an employee to participate. All the necessary products are in the box for 25 individual screens. There are some other things you need to pay attention to. The manual, I just keep it out on the desk. It's in a variety of languages, so it's not as big as it looks. Just turn it to the English section. Mine's broken apart because it's been open so much. It answers a lot of questions, so please focus on that. There are also 2 quality control swabs. One's positive, one is negative. You probably won't even use them. They're just as a check if you think there's a problem with your testing. While the positive control swab does have protein on it from the COVID virus, it is not infectious, nor will it provide anyone with the virus. Most times just ignore these. You receive enough buffering agent for 25 screens. Don't spill it, and don't try and cut corners, and don't throw it out after one use. And when you're done using it, please put the cap back on tightly. The first step is to hold the buffer bottle vertically and line it up with the marked line on the test tube. Using too much or too little could result in incorrect readings. Place the test tube in the rack, place a cap upside down. Don't put your fingers in the cap. Then I go get one of the swabs. I carefully remove the swab with the swab end down. Carefully remove it. Careful only to touch the handle and not to let that touch anything else. Then I tilt my head back about 70 degrees. And an employee would do this. You would be supervising them. But an employee will tilt their head back 70 degrees and they will rotate 2, 3, 4, 5. What I'm doing is I'm going about 1.5 to 2 centimeters, or just to where you fit, like almost you feel a bit of resistance. Then you repeat on the other side. Again, rotate against the back of your nostril. 3, 4, 5. Then you repeat again and do about 2 to 3 seconds per nostril. Then I take the swab and I put it in the test tube filled with fluid, and I swirl it around. I make sure the swab goes against the wall about 5 times. 2, 3, 4, 5. And it says this should be in here for maybe 15 seconds to a minute. So this isn't a 3-second process. I feel that's more than 15 seconds. Now what I do is I reach up and I squish the container because it's soft, and I make sure I squish the swab out, all the liquid out, so it's in the bottom. And then I go and I break this at the spot, and then I carefully put the lid back on again. I don't touch the inside of it. I carefully put the lid on. And now I go here, and this is my sealed test.
Okay, you have
and
to
in
open
this
the sealed
is a
well
and a little
and,
testing package. I'm very careful when I touch it, that I don't touch the face or the bottom. And if you wanted to, you could put a name on the bottom of this at this point. But I put this down. I be careful I don't handle anything around the edges. Then I take my, this is a funny word, but you take the lid off the bottom of the test tube and you put 5 drips right into the well. So I go 1, 2, 3, 4, 5. Now, some people have commented that when it changes color right away, they're concerned that it means something. Don't even look at it for 15 minutes and don't wait longer than 20 minutes. So the best time to test it is between 15 and 20 minutes. You might want to set a timer for this. So now, reading the results. This is a bit like a pregnancy test for those familiar with them. On the test, there is a C and a T. The C is for the control. And if the control line is marked, then it's negative. If the T line and the C line both have lines, 2 lines, kind of like a pregnancy test, then you know you're positive. And if only the T line appears, that means there's a problem with the test. And it's invalid. You can't really see, some people are worried when they see this red come across, but don't worry about that. But you'll see a C and a T. So again, a C, just one line, the control line C is negative. A C and a T is positive, and a T alone is invalid. Now this, and then what we shouldn't, I picked it up, but you shouldn't pick it up. You should leave it down for the whole testing process. I did that for the camera, but please leave it down. Don't touch it for the 15 or 20 minutes. Now, just so you know, we have a plan for the waste. This is considered hazardous waste. This is considered hazardous waste. Everything else can just go in the garbage. And we have a nice yellow bag we're going to hand out to you to put your waste in, and you can bring it back. This is a screening process, so staff should probably be screened about twice a week. This does not replace a vaccine, physical distancing, hand washing, and mask wearing. This is another tool to keep the community safer. And this test is for asymptomatic employees who actually go into the workplace on a regular basis. These are not intended for employees who are working from home. They're not for your family. They're not for your friends. If your employee count was not accurate, don't worry, let us know. We are getting more tests all the time, but please give us a bit of advance notice so we can make sure we have tests ready for you. Please refer to your local chamber, rapidtestmuskoka.com or rapidtestorillia.com for updates and frequently asked questions and other information related to the screening process. Chambers of Commerce are doing this as a service for businesses in the community, and I'd like to thank all the chamber members who help make this possible for us, that we can do this program. But because it's COVID, we are welcoming every business in the community to come take advantage of these rapid tests. Please be patient with us. It gets busy, but we're doing the best we can. We're also very excited that we have a poster that will be distributing that you can put in your business to say that you are participating in this program. And I'd just like to say thank you once again for keeping our businesses safer, for keeping our community safer, and keeping us looking forward to when we go to the new normal. Thank you.